So, here's a headline you probably didn't expect. Robert F. Kennedy Jr., yes, the independent presidential candidate, just floated the idea of making Jim O'Neill the next CDC director if he wins the White House. And if you're scratching your head, you're not alone. This is a pretty big shakeup, and it tells us a lot about Kennedy's strategy, and maybe even the future direction of American health policy. Let's break this down. First, who is Jim O'Neill? He's not a doctor. He's a former biotech investor and was a senior official at the Department of Health and Human Services under George W. Bush. He's also closely tied to Silicon Valley. He worked alongside Peter Thiel, the tech billionaire, and has a reputation for wanting to radically change how the government deals with drug approvals and public health. Now, the CDC, Centers for Disease Control and Prevention, is a big deal. It's basically the country's lead agency for keeping Americans safe from infectious diseases, health threats, and, as we saw during the pandemic, a lightning rod for political battles. The director has always been a public health expert. O'Neill would be, well, a total outsider. Kennedy's move here isn't random. He's been openly critical of the CDC and the FDA, especially around vaccines and the COVID-19 response. By picking someone like O'Neill, who's argued that drugs should be approved faster and that the government should trust people to make their own health decisions, Kennedy's signaling he wants to shake up the system, maybe even break it open. But this is where things get controversial. O'Neill has said before that drugs should be approved as long as they're safe, and effectiveness can be figured out later. That's not how things work now, and it's a risky strategy for public health. Critics worry this could lead to dangerous medicines getting into the market. Supporters say it could mean faster innovation and more choices for patients. So, what does this all mean? If Kennedy actually wins, and if O'Neill somehow gets confirmed, the CDC could look very different. We might see big changes in how health crises are handled, how new treatments reach people, and even how much we trust the institutions meant to protect us. It's a bold, maybe even wild suggestion, but it's the kind of move that gets people talking. And with the 2024 election campaigns heating up, you can bet this debate is just getting started.